Saturday Night Live hasn't. I haven't watched Saturday Night Live in a while,
Oh, I've
Chris.
not watched it since 1990. I mean,
Yeah,
I actually am old enough that when the original Saturday Night Live started,
yeah,
1978 or 76, something like that.
yeah.
Yeah. So anyway, I wasn't allowed to watch it, but I remember, and then the 80s, the Jim Belushi and all those guys. So
Yeah.
anyway, all right. Well, I won't keep all this silliness going.
Well, cool. Um, well, I guess we can get started.
Okay.
So, one of the reasons why, obviously, we want to do this is because we were talking and we were having a conversation a couple months ago about suspension trauma syndrome. And for people that don't know, essentially, suspension trauma syndrome happens whenever somebody wears a fall protection harness and they fall with their harness on. And whenever they get trapped in that harness, they get a condition called suspension trauma syndrome. So, with me teaching classes about fall protection and everything, I wanted to ask you, what your opinion was on it, because essentially there's a lot of people when those classes happen that they ask questions about suspension trauma syndrome, and I don't think there's a ton of medical literature about it. So I was like, oh, I'll call Dr. Bowers. He would know. He's a good contact for that. So
Sure. Yeah, let's talk suspension trauma. So the thing we will, from my standpoint, it's always a physiological or an anatomic question. What's happening that's causing an effect in the body. And so I've made a little drawing. It's not, high art by any means, but this is just to give you an idea. Here's a little subsection of the body. Here's the leg, the hip. There's your hip joint. This is your iliac artery coming down, your iliac vein coming down. These are the main blood supply into and to the leg, down to the leg, and then back from the leg. And then you got a little circulation that comes from another place. Doesn't really matter, not important. What is important though is that in a suspension trauma, you get a strap or a harness that shuts off this circulatory flow right here, both flow down and flow back. And initially, it's the flow back that's the bigger issue because you can get up to 20% of your bloodstream or blood supply in the legs in a suspension trauma. So on my little mannequin here, I've got this harness, and obviously this is not sold by any major manufacturers. I've created this myself. It's impressive, I know, but so coming across the inguinal region right there, this strap is now blocking that off. If this person is hanging here, it's a 7 to 30 minute process with an average of 14 minutes before serious side effects happen. Now, what are the side effects? So I'm just mentioned that there's 20% of the blood flow stuck down here. Well, if you have 20% down here, that decreases the amount of blood that can circulate back to the heart and to the brain. Unconsciousness can come in as quick as 5 minutes in a suspension trauma
yeah,
from shutting down this blood flow. Then brain injury in a flow situation comes from the lack of oxygen. And in the brain, anoxic brain injury occurs in 4 to 5 minutes. So 4 to 5 minutes without sufficient flow to the brain, you've got a problem. So if we have somebody hanging, we think that the fall is the biggest problem. The fall actually, with the systems that are available today, the arrestor systems, so that my person falls, the harness catches them, then to avoid injury, what they need to do is move their legs. Move these big leg muscles, your quadriceps, your hamstrings. These muscles are going to help push flow back up. If you happen, and ideally, and a company will have will have a harness that has one of several features. Either it has foot loops that are able to be detached or drop down from the harness so that you can put your foot in the harness and stand to use your legs. It may have a bench or a seat platform that allows you to sit again to relieve. So, if you can move yourself into a cannonball like position, if you think about, when we used to swim and dive and jump into the pool in a cannonball, pulling these legs up, again, we're trying to decrease the pressure on the inguinal region right there and help circulation flow.
so really the main issue with with suspension trauma is the flow return is what's causing it. So
Correct.
so essentially all of your blood is pooling in your legs.
Correct. A large portion of your blood. We have about 6 liters. So 20% of that, let's say you got 2 liters in your legs, and that the brain is the first thing that the body always tries to save and send blood to, followed by the heart. Then you have your liver and your kidneys. All of those systems are in danger when you are stuck in a harness and the flow is compromised.
Yeah. Yeah, that's very interesting. So if they, let's say they fall off a side of a building or something like that, they're doing roof work, they fall off the side of the building, maybe they don't have leg straps. Could they, in theory, push off of the side of the wall and
Absolutely.
then help relieve some of that pressure?
Yes, yes. So you could push like you were rappelling, assuming you were not able to lower yourself down from that position. You could bounce back and forth off the wall. If you can't bounce, but you're able to support yourself and your straps and just raise your legs up and down, even any kind of movement is beneficial. If you have, you don't have straps or another thing, but you have a secondary rope of some nature, you can create your own strap and drop it down, put your foot in that, and use that to give yourself some leverage and decrease the pressure.
Yeah, I always thought that was interesting because, I see all these stories where if you go to like a theme park or amusement park or something like that, and the ride, let's say it gets stuck and you see these people like suspended out of the air and they're just up there dangling for a couple minutes or something like that. And then they're most cases they're fine. But I guess from that perspective, it's probably because they can relieve that pressure off the leg, or if they're upside down, it's not pulling in their legs; it's pulling the opposite way.
Yeah, if you're haven't been to or been on a roller coaster or a theme park a long time, I think I've ridden exactly one of those rides where you sort of sit and dangle beneath the ride. But that in that case, though, even though you feel like you're really exposed, you really are sitting on something, and so you're with the I guess the pubic rami, this bone on the bottom, you're still sitting here is allowing enough relief from support so that you get that circulation and it's not being cut off.
Yeah.
But I may need to go ride some roller coasters to double check that.
When's the last time you rode a roller coaster?
Ooh, I rode a roller coaster, I think it's probably like 2010.
2010?
Actually, no, it's probably 2007.
Where was it at?
I rode, the last roller coaster I rode was at Carowinds.
At Carowinds?
Yes.
I don't even know when the last one that I rode, because normally if I see like some of those like pop-up carnivals or festivals or whatever, I try to stay away from those because they're all like Shell LLCs or whatever. And I know those aren't the safest. I think the last one I went to was at Cedar Point in Ohio, which was a long time ago.
Yeah, I can remember I rode it with one of my sisters. We rode, I think it's called Thunder Road. It was a NASCAR themed.
Yeah.
And in fact, I think I also saw they had a structural failure.
Yeah.
On that very roller coaster.
Yeah, I've been seeing that a lot. That's interesting. So we're in your office here, for those that don't know. So tell me a little bit, obviously you have this practice that you started on your own, and we do some work together. With me on the safety side. There's a lot of companies that want respirator fit testing and medical evals. So you do the medical evals and then I do the respirator fit testing, and it works out really well, and they can normally get their results, really quickly compared to some of the other occupational health clinics around here and some of the other companies. But I guess what I'm asking is if you can explain how Carolina Health is a little bit different from some of the other clinics from here and what you guys offer.
Sure. So James, my medical partner, and I, we started this practice because we were tired of the healthcare hamster wheel. We both worked for large hospitals, and the institutionalized medicine was getting to a place where neither of us felt like we could do medicine at its best, and we could address needs as they need to be addressed. And also that access was an issue. So we found direct primary care as a model to deliver health care. And what that simply means is we operate on a membership basis. Our patients are members, and I like to say it's different than concierge. A concierge medical is different in the sense they often offer some extra things, but also at extra cost. And our goal was not to nickel and dime individuals. It was to be present when you needed assistance, to give you good medical advice, to guide you in medical choices or lifestyle choices that you were making. And the way we do that is by simply a monthly membership. And there are some things that are beyond our scope. And so what we've done is create a network of other colleagues, both specialists, and in fact, we now in the upstate have an imaging center that is a cash-based imaging center, so we can get really good MRIs and CTs and a quick turnaround on those things as well, without having to wait and all of that. So that's the formation of why we did what we did. And what we found is everybody has our phone number, and they call us when they need us or they text us, and we're able to decide if we need to meet at the office for an appointment or if it's something that can be handled virtually. I do a lot of telehealth. I call it telehealth. It really is often text health, with individuals texting me an issue or sending me a picture of something, whether it's a actual spider bite, which we had the other day because they had the spider. Many spider bites in my medical career are more likely to just be a folliculitis or a thorn that poked you in the garden and no spiders involved, but this was a spider that was involved. And so we took care of it. And then actually just before we shot this video here today, we were draining a knee that I say draining a knee. Actually, we were draining a superficial wound that we hope is not deeper into the body structure. But we didn't have to, or I should say, our member didn't have to go and wait for a procedure to happen either several days, even just several hours. It was a matter of a quick text followed by a phone call followed by see you at the office. And that's what we do best, is access.
Yeah, I'm really biased because obviously I'm a member.
Mm-hmm. Right.
And I think the thing that I like the most about this structure that you've set up is, like you said, where I can just, give you a quick call or text or do a telehealth session or just schedule an appointment and come in. Sometimes on pretty late notice, mm-hmm. and even day of notice. Plus, with the insurance side of it, I know a lot of companies offer insurance, but a lot of the clinics, they make it hard to get your benefits. Mm-hmm. Like, I know even when you go to a dentist office or any healthcare provider, a lot of times the insurance companies, they make it hard on the companies to collect that money. So in turn makes it hard on the patient. So that's what I like about, your practice the most.
Yeah, we felt like it would be beneficial for us to not have to deal with all of the paperwork and the red tape that comes with insurance. I have often said insurance is a necessary and good thing. Many of our members have insurance through their companies or private policies, but that insurance is not for when you think you have a cough or a cold or a sore throat, or you cut yourself and you need a couple of stitches. Well, unless you cut your leg off. Okay, different. Or suspension trauma. But that insurance is for when the drunk driver slams into you as you're simply trying to pull out of your driveway or something like that,
Sure.
For serious trauma. We do have members who've had very interesting medical conditions that have arisen, and the insurance has been invaluable because they're $1 million surgeries and follow-up and cancer care and stuff like that. So it's not that we're opposed in any way to insurance. What we're trying to do is save time and save money for our member for issues that can be handled beyond or at a level that doesn't require the complexity perhaps of a specialist.
Yeah.
One of the things that and my medical partner is a nurse practitioner. I will say he's
Oh,
probably,
he's very good.
yeah, he's
Yeah.
one of the smartest people I know.
Yeah.
And he will, and he's also very, I forgot the word I should use. He's very humble. You
Yes.
know, I often try to tell him how smart he is, and he just pushes it back on me. But that is, you know, part of the joy and genius of our relationship is that we complement each other in our ways of working. He is very detail oriented. He's a very research driven individual. And I've been around long enough that I have sort of a broad base of experience. And so I've seen a whole lot of things. And so sometimes we combine, and he has been around, don't let me think
Yeah,
he's a
yeah.
spring chicken, but by taking those together, we will often talk about issues and bounce things off one another. And one of the ways that's beneficial to our member is that we are not having to have you in front of us as an appointment time to be thinking about you. We're sort of on call, if you will, or on retainer is one way to think about it. And so we're always working and researching and thinking about issues that our members may have. And then we can reach out and call you and say, hey, this is what's going on. This is what I think. Let's try this or let's try that, or did that work? Instead of just a call from the secretary or telling the secretary or the nurse or the front desk person, can you please, you know, contact Mr. Koenig, tell him I need him to come in and have a visit. And I understand that the electronic medical records these days, people can email back and forth, but having worked in a large medical system, that's not really set up, you know,
Yeah.
to have some sort of meaningful communication with every single person on your 2,000 person panel. So that's one thing. I guess sort of how we do what we do. You know, we're much smaller. As it relates to companies, we have several corporate clients, and we're working on expanding our corporate footprint or our availability to corporations, whether it's a two-man or a three-man plumbing outfit, or whether it's a 500-person factory. One of the things we offer is the ability for that company owner or that corporation's local manager to have their people cared for in a very efficient and timely manner.
Yeah, that's one thing that I like about us working together too, is that like we had said earlier, that whenever somebody needs like a medical eval or fit test or whatever, we can get them the results very fast, normally within 24 hours, versus some of the other companies. Me being on the other side as an EHS manager, I know that if I call a specific company who I won't name, it normally takes 2 or 3 weeks to even get scheduled, maybe if you're lucky. And then once you do get scheduled, they come on site and, you know, your results for 2 to 3 weeks after that. So, and then there's a lot of red tape and all that stuff along with that. So, yeah, I think that's one of the really good benefits of what you have going here is just the speed and I guess the being personable with everyone. I think that's one of the best benefits that you have here.
Yeah, we want to be liked. We want people. We want to like the people we work with. You know, we are fortunate that we have some wonderful folks. Obviously, you being, you know, your wife actually being the very first patient in this practice, first member that ever joined Carolina Health, and is still a member in that. I was just talking at lunch today with a young fellow who is going to med school and is looking at opportunities to for his residency, what he might want to do. And of course, I'm very biased toward family medicine, but really biased toward direct primary care as a great model. And I think it's a model that's going to continue to grow as folks realize that, hey, I can reach out and talk to my doctor when I have a question or an issue, and your doctor knows who you are in a very real way. That's the other side. I think I talk sometimes about being shepherd to the sheep, but you know, when we were deployed together, I was still working for a local hospital, but it was my nature such that I still logged onto the computer and did refills and answered medical questions and took care of folks because, well, they were my patients and I was the doctor. And so I wanted to be able to help them if they needed it. The insurance-based system's not set up for that. It's set up for you to come in, have an appointment, then the doctor writes a note, and that note then gets sent off, and that's how he gets paid based on whatever occurred in that. And our model, we're contracted to the company per individual that's assigned or I say signed up with us. And then, we don't think about that. That's not an issue anymore. Our job is simply you're one of the employees at American Health and Safety Systems, and you're our member, and we're going to take care of you. And if there's something that needs to happen beyond, let's say it is a suspension injury, and the person has fallen, and we're worried that there's actually damage beyond just the trauma of what's happened, then we're gonna find the imaging that needs to be done. We're gonna get the imaging performed. And then if there's a specialist that needs to be involved, then James and I both have a really nice network of local doctors and counselors from both the medical and the psychological side of things that we can refer people to help them after we reach the point at which we can't do it. And that's, I guess, one other thing I would say. So one of my things with being a family doctor years ago, my goal was to be sort of that doctor with a black bag that came down the street when you needed him. And what I meant by that was that guy who took care of everything he could. We try to do as few referrals as possible. And when we do refer, it's because we need a very specific thing. I'm not going to do a knee replacement. I'm not going to do an appendectomy. But I know people who can, and I know people who will. And when I send that member to that person, they don't have to guess about why is this person coming in. Because if it's one thing surgeons like to do, they like to do surgery. So I want I want to have identified the problem, identified the possible solution, and then get them to the person that can affect that solution.
Yeah, absolutely. So you said that you had been around the block for a long time. And obviously you went to med school, became a doctor, all that stuff. So I guess when you were growing up, did you decide that you wanted to be a doctor, or when did you pursue that career field? And what college did you go to?
So I went to undergraduate at Wofford College in Spartanburg, and then I took a bit of a circuitous route to medical school because Sister Mary Benedictus said I was going to be a minister. So I had to kind of get that out of the way, and so I actually went to seminary first, and then spent time in the parish, and then decided that's when I realized I had wanted to be a doctor when I was very young, and didn't maybe necessarily think I was smart enough. I didn't have maybe the self-confidence for that, but at a certain point in life, I had found that self-confidence and decided that was how, well, I can cut it short and say when I was a chaplain, I got tired of being the last one called to the room. And or I wanted to be the doctor who said call the chaplain and then left the craziness. And I have stories I could tell, for another day I will, but that sort of began the process of, well, what would it mean to take the skill set I have as a person who's relatively personable, listens, and really cares for people. I would have probably been a terrible business person if I was just making widgets, because I'm not really interested in widgets, but I really groove on people. Today, when I was visiting and having lunch with my medical school friend, I was saying, he said, I really like talking to people. And I agreed. That's exactly what I do most days. I come to the office, or I pick up the phone, or or turn on the video monitor, and I talk to somebody. Whatever's going on in their day, right? And granted, that's kind of what priests do, what ministers do, but then I wanted to do more. I wanted to focus on today's issue. You know, instead of the promise of tomorrow, we'll let the new Pope handle that one. But
The new Pope.
from Chicago, the Pope, and Eucharist is now going to be deep dish, in case you didn't know. It's a little religious joke, but I did. So when I decided to go to med school, I was fortunate. I went to Kentucky to medical school, and then in my residency training, I realized that I really enjoyed. Family medicine was what I enjoyed. I liked a certain amount of each of the different medical disciplines, if you will. There are certain parts of psychiatry that are fascinating to me, behavioral health, the OB, which I don't do anymore, but in my early career I delivered babies, and that was fun. And the pediatrics, I'm a cradle to grave kind of doctor. I can hatch you, I guess because I was a minister, I can match you, and then, well, I sadly have been there when some were on the other end of that equation. But the whole transition of life is interesting to me, and the journey that people have along the way. And so I do believe there's better living through chemistry. I joke sometimes that I go to work and I dispense or I write medications all day long, and then I come home. But some of those medications prolong individuals' lives. They improve the quality of their life. And then one of the things James and I both try to do in our practice is take people off meds.
Yeah.
What can we do, because we are not beholden to insurance companies or beholden to corporate, I don't even know what the right word would be, but beholden to box checking where you have to have this and this and this and this.
Well, I think in a lot of different medical practices, and correct me if I'm wrong, but from what I understand, a lot of these hospitals and clinics have a certain interest, like as in there's companies that come in and say, hey, please, recommend our product or something like that. Does that happen?
Well, we've stopped. So there's no more, for the most part, the studies did show that were done in the late 90s, early 2000s, that medical reps in the office did influence what was prescribed or what was used.
Yeah.
Now, we're not a surgical practice. There are, a whole world beyond my knowledge with folks with devices and applications and stuff like that. We don't have medical reps come. We don't see them. We follow all the latest medical guidelines and what medications are new, what therapies are there. No, what I was talking about with box checking is more of, did you have an A1C every 3 months or every 6 months? Have you had a cholesterol panel every year or within 5 years? Do you have a DEXA scan? While there are preventive measures that are important, there are also some incentives that are built into that, I think, and we're not practicing medicine to incentivize our accounts receivable.
Well, that's why I love this practice and this idea, and I love working with you and having you as a provider as well, is because I think that you guys push actually getting people healthy and not just treating some of the symptoms like a lot of other doctors do. And I don't know if they do that purposefully, but I think maybe the reason why some of them take that approach is because they don't have enough time with their patients, because they're just getting cycled through so many faces that they don't have enough time to build a good relationship with them and actually understand, some of their issues.
Yeah, I'm glad you brought time. Time is probably the biggest issue. And I think that I have some wonderful colleagues that still do traditional primary care, that's hospital-owned practices, and they will have that as a frequent concern, that they don't have the time they need to fully be present, is what I say.
Yeah.
They are brilliant individuals, so they can understand the complexity of the medical situation the patient's having with no problem, but it's the time to be present and sit with that person and just say, what's going on? Tell me what brings you in. Why are you here? And that's one of the biggest reasons James and I stepped off what we called the healthcare hamster wheel, because we both wanted more time. We wanted to be able to sit down and say, well, Kyle, what's new in your world? And not just what's bothering you today, what's hurting you. Because what I've found is, and as an osteopathic physician, one of the ways we were taught to view the person was not as an assemblage of body parts. You know, you're not a brain, a liver, a heart. We were talking about suspension trauma a little earlier, and I was breaking it down from a very pathological standpoint.
Yeah.
But the reality is, it's a whole person that's hanging there, right? And so, you know, one of the first things I was thinking about when I was thinking about what we would do resource-wise for somebody who's been in a fall like that, to me is what's the psychological part? You know, what's the brain, what's happened to the brain, not just from a circulation injury standpoint, but the trauma of falling. I'm a person who's afraid of heights, so I'm probably not going to have to worry about suspension trauma because I don't want to get up there.
Yeah.
So now I went down a little bit of a rabbit hole, but had we been in a traditional office setting where I've practiced before, our time would be over. You know,
Yeah.
I've seen 4 to 5 patients in the time that we've been sitting here together today, not necessarily because I wanted to, but because I had to. Because in order to fulfill the obligations of how that entity sets up their business structure, right?
Well, yeah, the most of those business structures are set up. I mean, everybody's at the end of the day has to make money in some capacity.
Correct.
And a lot of those businesses are set up to maximize, profits at the end of the day.
And I'm not saying that medicine isn't business. I mean, this is my livelihood.
For sure.
I am very fortunate to be doing something that I have chosen to do. James has talked about that same thing, that we get to come to work every day and do what we do, and that's a great blessing. But we do put food on our table. We pay for our own children to go to college and stuff like that. Those are bills we have. We are not a charity. But the pendulum has swung so far in I call it the institutionalized medicine, so that we need to see 26 patients in the day to meet whatever financial numbers are to support all of the other staff that are required to practice in that type of environment. You know, we get calls here every now and then. We do have an answering service that takes the calls for us, the receptionists, they work closely with us. And one of my favorites are the cleaning companies. Now
I get those calls almost every day.
I love a good cleaner, and and they're wonderful people working hard. However, we don't need to hire one because I am the janitor.
Yeah.
You know, James empties the trash. I clean the toilets. That it's a 2-man operation, right? And so at some point, perhaps if we are 3 or 4 or 6 physicians in this practice, and my daughter who's a PA is in the practice, and another NP along with James in the practice, then maybe we will need somebody else because of just the sheer volume. But for now, we can handle that.
Yeah.
But if we are insurance-based, then we've got to have a whole other group of staff to handle all those complexities. And we don't have to do that.
Yeah. So going back to whenever you first started getting into that practice, what made you want to join the military, and at what point did you join the military?
Yeah, so I was very fortunate. My first week in orientation, a gentleman from the Army showed up and said, "We will pay you to go to medical school."
That's a pretty good deal.
I thought that was a good deal. And I asked him, I said, because I went to med school late, right? I had a whole other full career. And I said, I am going to be 41 in 6 weeks. Will you take me? And I'm proud to say that of the 7 people in my medical school class who tried to get into the program, I made it. I might have just been the squeakiest wheel, but that began it for me. And it was a wonderful program. It was done through the Army National Guard. I chose National Guard partially because they chose me. It was a perfect timing. And also with the Guard, it is a state resource, not a federal resource. Now, you and I both deployed on orders that were federal orders, and we were working under to protect the Constitution on the orders of the president, if you will, however all that works out. But if the situation was such that we had a issue in the state, we are state assets that we can then go, the governor can call upon us to help. And Hurricane Helene came through, I guess, last October.
Yep.
Members of my guard unit, I'm the brigade surgeon for the 228 Signal and the 151 Signal, and also the Cyber Battalion. And so they were tasked with certain things, and I'm able to be a part of that. That was very attractive to me. And so that began my journey. It seems like a long time ago. It's only, well, I don't know if I even want to say how long ago, because that would give my age. And I know everybody thinks I look really young. So let's just say I can retire, but I'm not going to.
Yeah.
I do. I want to. In fact, I've joked that I want to be the oldest doctor in the Kentucky. Sorry, I was in the Kentucky National Guard. I want to be the oldest doctor in the South Carolina National Guard.
Yeah.
And I'm doing a good job of getting there.
What rank are you right now?
So I'm a major.
Okay.
And I think I'm promotable in another year or so.
Yeah.
It's a slower process in the Guard. I don't know.
Yeah, I'm sure there's less slots and
Yeah,
some
yeah,
cases.
exactly. And
Yeah.
so it's not a, and I will say that I definitely don't do it for the rank. I do it because I love interacting and helping the soldiers. I just like my medical practice, I try to be available to the members or our service members in our brigade, and it goes across the state. I do get calls occasionally from other colleagues of mine. Hey, can you help me with my soldier? What's going on with them? And absolutely, if I can. And I will say that my activity through the South Carolina National Guard, my participation in the Guard, has been a direct benefit to a number of our members at Carolina Health, because I've been able to call upon several specialists who are also members of the National Guard.
Yeah, that's a good point that I didn't think of, is that
Yeah.
you get a lot of good contacts that are also in the Guard, like medics,
Yes,
stuff like that.
yes, and the in fact, the person I followed, and I won't say the specialty or the name, I won't blow his cover, but the gentleman that I then followed on your deployment, I came in to backfill for.
Yeah.
He has helped several members, and he is a very influential person in the medical surgical community in Charleston. And I was able to call him and say, can you help me? I'm not sure which direction. And not only has he seen patients, he's then also referred me with a personal handoff to another specialist. And that sort of camaraderie is also what the military is about. It's having, when you called and said, hey, I hear you're starting to practice, my wife has an issue. That's a camaraderie that we wouldn't have had if I hadn't have been in the Guard. And I think we have, well, we're well into the double digits in our civilian medical practice of guardsmen and guardswomen in South Carolina, because we've interacted.
Yeah.
I got a story for you, kind of random in a way, because it's a small world, right?
Yeah.
And the Army is an even smaller world. Well, I was down in Beaufort, South Carolina in October, right after the hurricane, and I was helping another colleague of mine who has a direct primary care, an amazing primary care called Authentic Family Medicine in Beaufort. And she was needing to be away for a while, and I was able to go fill in for her and help her practice. And James was holding down the fort up here. And so my wife and I are having lunch one day on this wonderful restaurant on a pier, or it's a screened porch, but it's over the water. And my phone rings, and the person on the other end says, hey, Major Bowers, do you remember me? This is so-and-so, Lieutenant so-and-so. You talked to me when you did my physical about 3 years ago, and I was wondering if you could help me with my husband.
Yeah.
And so it's a medic who then went to PA school, and now she and her husband are in the upstate, and her husband's a member of our practice now, and just a really neat sort of.
Yeah, the Guard is a small place. I actually was at Long. Do you remember Long?
Yeah, I saw you
I was
post
at
a
his
picture, Sergeant Long. Yeah.
yeah, I went to his promotion yesterday, and then I saw Roke there,
Okay,
and
yeah.
we were talking and telling stories and all that stuff. But it was funny because I didn't expect to see him there, and I saw a lot of other people there that we worked with as well. And yeah, the guard is it's definitely been very beneficial to me and a lot of other people that I know that have joined as well.
Yeah, I think it's a sense of, for me, it's a sense of belonging,
Yeah.
being a part of something that's bigger than myself. Um, I have a chance to serve. Both of my grandfathers were, of course, World War II veterans. My mother's father landed on Omaha Beach. He then stayed in Germany with the Army of Occupation, carried the same $2 in his pocket throughout the entire war, which is now in a safe deposit box that my uncle
Is that something that persuaded you to join?
Yeah, it was very much a part of it. I didn't know how to be a part, right? I knew not to be self-demeaning, but I probably wasn't a door kicker.
Yeah.
I didn't have the type A personality. Or when I was growing up, we were in the 80s there. We really weren't going anywhere or doing anything that made the military catch my eye, if you will, or think, hey, I can be a part of it because I can do this. And when it was when I decided to go to medical school, that's when so there's a wonderful quote, if I can get this correct, from Frederick Buechner, who's a Presbyterian theologian and minister, that says, the area of your greatest passion and the world's deepest need is your calling. Now that's a paraphrase, it's not maybe exactly right, but that's what happened for me with the medicine and the military. Suddenly, when I was going to medical school, I was going to have a way that I could serve in a meaningful capacity in the military, because I had watched MASH.
Yeah.
I knew what Army medicine was about, and I could be one of those doctors. And I joke that that's where I get all my military bearing from, is MASH. And,
Yeah.
I think but that was, as silly as those guys may be for a role model,
They were pretty silly.
but they showed that dedication, right?
Yeah.
And the place where I could do, because I mentioned I'm afraid of heights, so I don't really go jump out in airplanes. I've got a best friend who had a full military career, Ranger, all the bells and whistles, all the tabs, so to speak, high speed, special forces, kicked in the doors, done amazing things to protect our country. And I feel blessed to have individuals like that who are protecting our freedom. What I can do, is take that bullet out.
Yeah.
And I had a first sergeant who once said to me, I was younger, LT, you're just a waste of a good bullet. And I told him, I said, well, Sarge, when I'm taking that bullet out of your ass, we'll revisit that conversation. And I have removed a couple of bullets, but that's not something I do every day.
Yeah.
It's not and not something that hopefully we'll need to do.
No. Yeah, the military's it's a funny place. It's like a comedy show every day almost.
It's a unique environment. Every big organization has their own flavor, and I think that there are some amazing people that do amazing things, and that's fun to be around them and to learn how all the pieces fit together.
Yeah.
Sometimes in the medical end, it's a little more difficult because we don't see all the different, now being in a brigade setting and a unit outside of the joint forces or outside of medical command, I get a little broader view and I get to see more pieces, and it's cool.
Yeah, sometimes it's interesting. So I have my brother. He just retired as a major. So it's funny. I'd have a lot of conversations with him and talk about, like what you said. It's interesting getting other people's perspectives where all the pieces fall. Because like me, obviously I was enlisted as a medic in an infantry unit, versus my brother and people like you and everything that are officers. You talk to those people and you're like, oh, okay, that's what makes sense why all those things are done that way. Whereas sometimes you don't get all the information on the opposite side. But yeah, it's very interesting. So one of the last things I want to talk to you about was, have you seen? I've been seeing this new medical device, the IVAC or something, or what is it? The one where people are choking and they're the life vac. Have you
Okay.
seen that?
I have not seen it. I've heard of it, but I'm not
Okay.
familiar with it.
I'll have to get you to do some homework
Okay.
on that or ask you to because
Yeah.
they there's a new medical device I've seen the last couple of years that a lot of people are using called the Life Vac, where
Okay.
it's basically where someone's choking and it's kind of like a plunger that you put on them.
Okay.
And I've seen a lot of police officers and EMS people. I haven't seen any like official.
Right.
I get like Spartanburg County. I don't think they're using it right now.
Does it push the food or the blockage down,
It kind
or
of
is it
sucks it out.
sucks it out?
Yeah.
Okay. Well, I can see where that would be really handy because
Yeah.
I mean, doing the Heimlich maneuver is not as easy sometimes as it's not hard, but depending on the habitus or the body habitus or the size of somebody, I mean, that could be
Oh, that's
tough.
something that I get in my first aid classes because I teach first aid CPR AD all the time, and it's sometimes it just works out when we're doing the portion with the Heimlich maneuver. You have one individual that's 5 foot tall, 100 pounds, working with another individual that's 6'5", 400 pounds.
Right.
And so there's all different sizes of people. So sometimes it's hard for those people to, get their arms around them or get them in a position where they can get leverage and everything. So that's what I was going to ask you because I get asked that question probably every single class that I teach for first aid is the life vac.
Yeah, I will look into that. I
Yeah.
think that from the sound of it, I think it's something that really should be a standard equipment. We found the AEDs now are everywhere, the automatic electronic defibrillator, because while people could do compressions and are taught to do that, the ability to sort of just put pads on and have the machine administer shock and perhaps get someone back in rhythm is incredibly important. And the faster it can be done, the better, and not having to wait on EMS to come. We have had two different opportunities actually in while on duty in the guard on drill weekends
Yeah.
when both different times individuals have had gone into ventricular fibrillation and dropped, one right in front of me and one down the hall in another part of the building. And at both times I was first responder to one because he's right in front of me, and then to have the AED. And now I see them, they're everywhere: Costco, Sam's, Walmart, whatever store you go in. Many the grocery stores, they'll have them so that they can be accessed quickly. I would think the Life Vac should be one of those things too, probably to go.
Yeah, I didn't know if you had heard about it or not because I had seen a lot of videos and stuff on that device, and I
Okay.
hadn't seen a lot of, I guess, actual doctors' offices or practices or EMT trucks or anything like, or EMS trucks or anything like that
Yeah,
that have been carrying them yet. But
well, it
maybe I'm
sounds
just
like
not.
it would be more like, I did my time in the restaurant business, loved it. I washed dishes, I was a prep cook and all that. And I could see where a restaurant would be, I would want one on the wall next to the fire extinguisher as well, because, people are eating, that's where they're going to choke on things more
Yeah.
often than not.
When we were deployed, somebody choked in the cafeteria in front of us.
Yes, I remember. So I was in the combat aid station, and the medic who I don't know if it's the same instance you're talking about, but I remember that the medic came walking in with his food. I was on the night shift there, and said hello. He said hello, and just went on to his part of the office there, and no hoopla, no nothing. And a little while later, somebody came in and they're like, "Hey, did you hear what happened at midnight chow?" And I was like, "No," or well, maybe it was eve. I guess
I think it was in the
it was
afternoon.
afternoon. So it was a regular dinner meal. And I was like, "No." Well, so and so saved somebody's life. I'm like, "You mean the medic who just came past here with like just another day?" you know? And that was amazing.
Yeah.
But he had the skill set, because my understanding was there were other individuals who were standing around or not doing the technique correctly, and
Yeah.
he grabbed them, used correct technique, out came the onion ring and the life was saved. I say onion ring because my father actually performed the Heimlich on me.
Oh,
I
really?
choked on an onion ring when I was like 10 years old. And my father was an Eagle Scout, 100% raised by the Boy Scouts. And I can still remember him, reaching past my mother and pulling me out of the booth. We were in Gatlinburg, Tennessee, and the next thing I know, an onion ring is flying out of my mouth.
Yeah. Well, I appreciate you, spending the time with me. I know you're busy and everything like that as well.
Oh, as are you. I mean, CEO of a growing and very needed company in this area.
For sure.
I think you do great things.
Well, thank you very much for sitting down with me and speaking with me about all this stuff. So I appreciate it and look forward to doing it again in the future.
I do too. Thanks so much.
Yep. Thank you.